So if you have red eyes, there may be a specific red eye pattern that can tell us why you have the red eyes, what is causing the red eyes. So in this video, we're going to break down a few of those patterns. One of those, if you have this pattern, you may want to put the phone down and go into your eye doctor right away. Let's focus in. This first red eye pattern is one of the better ones to know of, especially if you are a parent and you have kids that tend to stare at screens and you want to know if they've been staring for a long time and they're telling you no, and they have this linear red eye pattern, then chances are they've been staring at the screen too long. This is what we call the screen stare, dry eye, red eye. So what we're seeing here is interpalpebral redness. This redness is coming from exposure. So because your eyelids are open and you're staring at something, staring at screens, your iPhone, our blink rate drops about 50 to 60%. So that means that area that's exposed and open is getting less coated by fresh tears 50 to 60% of the time. And because this area is more exposed all the time, it kicks in the inflammatory response, which makes it more red and beefy looking, and then this is where that pattern comes from. So this is a typical dry eye. So this is a pattern that definitely gets me. These are my eyes. Definitely gets me if I'm staying up late, staring at a computer screen, working on YouTube videos, or responding to comments, and I'm just up late staring. Typical dry eye pattern. So if you go look in the mirror and your eye does look like this, then likely your eyes are really dry and you've been staring too long. The best way to fight this is try and keep the 20-20-20 rule. Every 20 minutes, you take that break for 20 seconds, looking 20 feet away, make sure you're blinking. Pretty much you're taking breaks from the screen. Also, I would add in there to use preservative-free artificial tears. Now, you want to try and be consistent with these drops because the key here is you want to try and keep your eyes from getting to this red eye pattern. If it's already there, it's really hard to backtrack with drops and breaks. So if you can develop a habit of the 20-20-20 rule, blinking and using artificial tears, that should definitely help. This pattern also has connections with a pingueculitis. So sometimes when people get this dryness, they sometimes develop a callus that is on the surface of the eye, a pinguecula or a pterygium, as seen in these pictures, and can turn into a pingueculitis. That pinguecula can inflame and cause maybe this linear redness that looks like this screen stare redness as well. So those are kind of linked. This red eye is probably one of the scarier looking red eyes to have, and this is a broken blood vessel in your eye. And so you get this really deep blood looking red eye, and this is called a subconjunctival hemorrhage. And because the blood does pop underneath the clear conjunctival layer, you're seeing that blood. It's kind of like seeing a see-through bruise on your hand. If your skin wasn't there and it was see-through, that's what it would look like. And so this is a bruise on the eye. Luckily, most of the time this isn't vision threatening, and a lot of times patients don't even feel pain or irritation from this. Most of the time someone else says, "Whoa, what happened to your eye? What is going on?" And it scares other people, and they make them go to the eye doctor to get it checked out. And sometimes this can be a mystery why this happens. There are a lot of people that just wake up with this popped blood vessel from the middle of the night and they have no idea what happened, so they'll come into the eye doctor and get everything checked out, and yeah, we have no idea. A lot of times this can be from lifting something heavy, lifting weights. That extra pressure can pop a blood vessel. If you sneeze really hard or cough really hard, maybe you're constipated and you're pushing really hard, you go hiking, some strenuous activity, you have some elevation change, you might be on blood thinners that put you more at risk of getting this. So those are all possible causes to this. But like I said, most of the time not vision threatening. Your eye will resolve and go back to normal. But in either case, if you do have this, it's always good to go into your eye doctor. They'll check all the other blood vessels inside the eye, outside the eye, make sure that everything else is really good. This next one, this is your classic pink eye. This is where maybe the whole eye does have this diffuse red, pink hue to it. There's some injection or redness kind of throughout the whole white part of the eye, has this glossy, watery type of eye. This is your classic pink eye. Now, a little bit tricky here can come down to trying to decide if this is more of a viral pink eye or bacterial pink eye. Sometimes allergic pink eyes will also look like this and can sometimes be mostly in one eye. Sometimes people will get it in both eyes. And so if you do get this, this might be the classic pink eye. So things to note here: is it really watery? Do you have a lot of goop or mucus? What color is the mucus? And is it painful or just irritating? Is it itchy? Are you waking up with your eyelids still shut? These are all things you want to know and bring it to your eye doctor. This will help the eye doctor know if you need an antibiotic or maybe just some artificial tears. Maybe it's just viral and we need to let it run its course. I do a bigger breakdown in this video right here. I'll put the link in the description, but I go over the different types of pink eye and when it might be allergic pink eye and what you can do about it. So I go over some of the treatments in there as well. So this red eye is a sectoral wedge redness, or sometimes we'll call it a slice of pie redness pattern. And it will just be in one kind of section of the eye, whether it's the temporal or the nasal, closer to your nose or closer to your ear, and it'll just be in one area there. Likely when it looks like this, the most common cause for this pattern is called the episcleritis, the inflammation of the episclera. And a lot of the times this can be a mystery as well. It can be idiopathic, meaning this will just jump out, happen to people with no rhyme or reason to it. Definitely can be associated with stress. So when people have a lot of stress, sometimes that will pop up. In some cases, it can be related or linked to some autoimmune conditions like rheumatoid arthritis. And so if this kind of keeps popping up, a lot of times people go in and start getting checked for any autoimmune disorders. So usually this is benign. It can be irritating, but usually not painful. There is a version of this that can look like this that is called a scleritis. So inflammation of the sclera, a deeper layer into the eye. And usually this one is painful. There is a boring pain. Sometimes it'll wake people up and they'll come in holding their eyes and it'll be really red and injected like this. This can be from a more serious condition, more serious autoimmune issue going on. So it's important for the doctor to distinguish between if it's an episcleritis or a scleritis. The treatment for episcleritis, usually self-resolving in 1 to 2 weeks. Patients can use cold compresses and artificial tears to help with comfort, and in some cases might be prescribed a topical steroid to decrease the inflammation. The scleritis, like I said, is the more severe one. A lot of times these patients will need an oral steroid or anti-inflammatory to help decrease the inflammation, and usually requires an urgent referral to rheumatology to do an autoimmune workup to see what's going on. So now this pattern, this is called a red ring around the iris or ciliary flush. And this is the case where if you have this, it could be an indicator of something really serious and you need to go into your eye doctor right now. What makes this tricky is that you can get this red ring of inflammation if you are a contact lens wearer. There's something called CLAIR, contact lens acute red eye, and when maybe that contact lens is irritating the eye, maybe you've been sleeping in it, maybe it doesn't fit well, or your eye doesn't like the material of the contact, it will cause the inflammation right around the cornea there. You can also get this type of pattern if there is maybe an ulcer that's starting to brew up, something wrong with the cornea from wearing the contact lenses, and so it kind of gives it away that something is wrong, something's going on. And so if you do see this pattern, you want to go into your eye doctor. A way more serious one, if you get this pattern and maybe you don't wear contact lenses, then this could be an indication that there's some inflammation going on inside of the eye. This can be an uveitis or an iritis. Usually this person is more light sensitive. There's more of an eye ache and eye pain, and there could be multiple causes from this. Some common ones may be autoimmune disorders that are happening. And so you want to go into your eye doctor so they can look in the eye and see what might be causing this, what type of iritis or uveitis. There are certain patterns that we look for inside the eye that might give away what type of autoimmune condition we might be dealing with. They also can prescribe anti-inflammatory eye drops to decrease the inflammation down so it doesn't lead to more serious problems down the road if you just let the inflammation keep getting worse. Another serious condition, this might be a sign of glaucoma, more specifically acute angle closure glaucoma. People will get this red flush ring around their cornea. They also might have a fixed mid-dilated pupil, maybe a kind of a filmier, steamy cornea. A lot of pain, their eye pressure is really high, causing more serious advanced glaucoma. And so this person needs to go into their eye doctor right now. So here's a summary of all the different red eye patterns and their possible causes. I hope this helped. In either case, definitely go into your eye doctor if you're just curious what is going on with your red eyes so you can treat and get to the core issue. If you have any questions, leave them in the comments. I'll do my best to answer any questions that you have down there. In the meantime, you can check out this video that I mentioned or look in the description. Stay focused.